Yeah, as described, the incident itself was very brief. You can see that there was not really an attempt made to verbally de-escalate or attempt to coordinate with the family to intervene with Victoria. We did try and have Victoria Lee's family come out, but they do live in New Jersey, so they weren't able to come and also speak as well. But they did have multiple public statements that were available online. And one thing that they had mentioned in one of their statements was, despite being informed that Victoria was a mentally unstable, non-violent individual of short stature holding a small folding knife, the police did not attempt to restrain her using non-lethal means, whether it be verbal de-escalation, taser, pepper spray, and I'm sure family intervention could have been included in there as well. So the first rally was held in August 15th. And these are a couple of photos that were taken at the rally, available publicly online. I did attend the rally myself. One of the things that I kind of noticed was, at least from my hospital, which is like the county hospital, for where Fort Lee is located, I was actually the only healthcare worker present. So that was pretty unfortunate. And just for our viewers, if you're not aware, Fort Lee is a very, very highly concentrated area of Korean American people. So this is all publicly available online as well. As you can see, Palisades Park, which is next door to Fort Lee, has a concentration of 53.7% Korean Americans as of 2022. And Korean Americans make up 6.5% of all people in Bergen County. The local psychiatric hospital even has its own Korean long-term care facility. So you would think that an event with the Korean American community would spark a little bit more discussion. So that's what we're trying to do here today. In regards to the impact on the Korean American community in Bergen County, I think this quote by Mr. Lee, the president of the Korean American Association of New Jersey, really summarizes, how people can feel. So I think people right now are scared to call 911, and then instead they can shoot without any protocols, like talking to the family. And I think the most unfortunate outcome so far is that as of the time of this conference, if you actually look publicly online, there's no information in regards to whether or not the Fort Lee police, had any, internal review and any punishments or any protocol rearrangements were made. There's actually nothing from, I believe, after I think October or November of last year, which I find to be pretty sad. So I'll turn it over to Dr. Ha and Dr. Cho to continue to speak.
Thank you, Dr. Andrew Lee. One of our students, Dr. Jae Yeun Lee, couldn't make it, so I'm going ahead to substitute and speak for her. The topic I'm covering is overview of the challenges officers face when handling mental health crises. So overall, the challenges facing law enforcement when dealing with persons with mental health illness, of course, unpredictable, erratic behaviors of patients. There's a lack of training among law enforcement, and mental health issues in law enforcement are prevalent as well. And there's also some vague or often conflicting policies regarding handling aggression in persons with mental health illness or developmental delay, such as the 21-foot rule, which we'll go over in the next few slides. I've also identified, there was a recent article by the by the Los Angeles Times about the LAPD, that there's quite a bit of dysfunction as well. That sometimes even there's a lot of police officers suing the police department over whistleblowers reporting, because everyone's kind of reporting each other. And it's come up to like $68.5 million in payments to kind of address these lawsuits that they're doing to even themselves. So what are the police afraid of? I think the classic case, and when I talk with some of my colleagues within the police force, I think one of the things they mentioned was like this kind of classic fear scenario where just last year there was a person named Sydney Wilson. She was a basketball player at Georgetown previously, but there was a mental health officer or CIT officer that went to do a mental health check on her, and then she just came out of the door and started swinging her knife. The officer pulled out his gun and yelled "back up" several times as she slashed, and then eventually, because she was reaching him, he shot her 3 times. But I highlighted the points. CIT officer, this is somebody that's trained with handling mental health, and still the tool that he first grabbed when he's dealing with this patient is a pistol. That's the only, and of course, high energy, very nervous, naturally you're going to use a tool in your hand. So like Dr. Yang actually mentioned, the Washington Post actually gets data about all the shootings. And on average, the police in the United States, they find, shoot and kill more than 1,000 people a year. And then data reported to the FBI in fatal police shootings were undercounted by more than a half. And by 2021, only a third of the department's fatal shootings appeared in the database. Now, why is that? It's because the local police departments are not required to report these incidents to the federal government, which is why we're relying on the Washington Post now. And there is an increased risk of fatalities of untreated mentally ill persons in police encounters. According to the Treatment Advocacy Center, persons with mental illness are involved in 1 out of every 4 fatal police encounters and 1 out of every 10 law enforcement responses. They comprise 1 out of every 5 people incarcerated in jail or prisons. And between 2017 and 2023, 31% of shootings by LA City Police involved a person perceived by officers to be living with mental illness. And in 2020, some other data, 23% of those suspects, from the most recent data I can find, were shot by police were armed with edged weapons. And then 10% of the assailants shot by police, fascinatingly, had no weapon at all. So you're not even safe even if you don't have a weapon. This is a bar graph, and this shows that amongst people that no action is taking, the police, amongst the people with no action is taking, you can still see that police encounters is, the good response would be, there's not that much kind of like a bad response or bad outcome. But if there's like a mental illness, that number from like 14% no action taken, if there's like a crisis call, there's like a 51% chance that there's going to be a crisis call happening or a bad outcome if the person has a mental illness. So already the police officers, when there's suspicion of mental illness, there's like a predisposition to fear of the mental illness patient. So mental health issues facing law enforcement and officers, you can see that this is a list that we've compiled percentage-wise. And yeah, you can see that it's very similar symptoms to trauma. And these are some of the quotes that are collected, anonymous quotes from U.S. law enforcement officers on their mental health. For example, we get 200 to 300 calls per night in dispatch, and not one said thank you. Having to deal with negativity, the worst aspects of society, not just people, but the worst possible situations, takes a toll on your mental health. And that's why we have wellness centers and employee assistance programs. Anytime we need to talk to someone, we can. When I kind of reviewed the case and I went ahead and talked with some other professionals who are familiar with law enforcement, one of the few things they bring up is the 21-foot rule. And this was a rule that was established in 1983 by Dennis Tuller in the SWAT magazine article, and it's titled "How Close is Too Close?" And what they predicted, or what they kind of found out, was from their findings was an assailant could sprint 21 feet in 1.5 seconds based on his experiments, and that's the amount of time it takes to pull out your gun and then fire 2 shots from an open carry holster. However, Tuller himself reports that this was never intended to be an actual rule, but more of like a guideline. And it's important to know this because the police that I've talked to, they actually take it more as like a rule of thumb or training, but you won't find this rule in any manual, like you won't find the rule in like the LAPD manual. And this is an example of the distance of 21 feet. But I point out these numbers because it's pretty difficult to